Medical insurance seems to continue its march right along with inflation. According to PhD John Goodman with the Eagle Forum report, there are 3 problems with the doctor-patient relationship in all developed countries, regardless of the way the payment system is organized. First, when a third party is paying the bill, neither the doctor nor the patient has any incentive to apply the kind of cost-benefit analysis that is normal in the purchase of any other good or service. In considering whether to obtain an expensive test, for example an MRI scan, the incentive is to consider only the benefit. Since cost is irrelevant to the patient, a tiny benefit, no matter what the cost, is viewed as desirable. Second, in a fee-for-service arrangement, the more services doctors perform, the higher their incomes. So, just as patients have an incentive to overconsume, doctors have an incentive to overprovide. Third, there is malpractice liability, which is especially a problem in the U.S. A doctor who orders an unnecessary MRI scan faces no real penalty, but no matter how improbable, there is always a chance that a scan not ordered will fail to detect a problem that grows worse over time. Our legal system, therefore, provides incentives for too many tests and too many procedures compared to a system in which costs would have to be justified by comparable benefits. These 3 perverse incentives make medical care unreasonably expensive with higher premiums and higher taxes. Does rationing care force doctors to be more efficient? Studies by the Rand Corporation found that this is not so. In Canada and Britain, scholars found just as much unnecessary care as a percent of the total as they found in the U.S. Fraud is an acute problem in government-administered programs. In Medicare and Medicaid, fraud is estimated to consume at least $100 billion a year. Hospital upcoding, claiming a higher level of patient severity and higher insurance payments, is another problem. One study estimates that increased upcoding relative to a decade earlier was associated with $14.6 billion in hospital payments. Although doctors are the biggest critics of claim denials, hospitals are by far a bigger problem. An important tool private insurers use to avoid unnecessary spending and inappropriate care is to require pre-authorization for a particular drug, therapy, or procedure. Doctors tend to regard these procedures as burdensome and irksome, yet only 7.4% of requests by patients in Medicare Advantage and Medicaid managed care plans are denied. Moreover, in the vast majority of appeals, 83.2% of the initial denials are overturned. Despite occasional complaints, more than 2/3 of Americans rate their health insurance as good or excellent, and that holds for all kinds of insurance: employer plans, Obamacare marketplace plans, Medicare, and even Medicaid. Even among people who say they are not in good health and who presumably need medical care, a substantial majority give positive ratings to their health plans. Only a tiny percentage rate their insurance as poor.